The real benefits and risks of statin drugs. A clear look at the numbers, the real benefits and risks of statin drugs. A clear look at the numbers in today's world of complex medical information. Understanding the facts about your treatment options is crucial. Statins are among the most widely prescribed drugs globally, primarily for lowering cholesterol and preventing cardiovascular events. However, many patients and even some physicians struggle to grasp the true benefits and risks associated with these medications. This article aims to provide a clear, evidence-based overview of statin therapy, focusing on the numbers that truly matter. What are statins and why are they prescribed? Statins, or HMG-CoA reductase inhibitors, work by blocking a substance in the liver that produces cholesterol. By reducing low-density lipoprotein, LDL, cholesterol often called bad cholesterol, these drugs help prevent heart attacks and strokes. According to the American Heart Association, high LDL cholesterol is one of the leading causes of preventable cardiovascular disease. However, the effectiveness of statins varies depending on an individual's baseline cardiovascular risk. For those with higher risk factors, the benefits are more pronounced, while for those at average risk, the advantages must be carefully weighed against potential side effects. The numbers game, relative versus absolute risk reduction. One of the most significant challenges in medical communication is how statistics are presented to patients. The way benefits and risks are framed can dramatically alter a patient's perception of a treatment. Consider this example. A study might report that a statin reduces the risk of heart attacks by 24%. This is the relative risk reduction, RRR. However, this statistic alone doesn't tell the whole story. The absolute risk reduction, ARR, provides a more complete picture. Table: example of statin effectiveness statistics, statistic example scenario interpretation relative risk reduction. 24% risk reduction appears more impressive absolute risk reduction, 3% fewer heart attacks more concrete understanding number needed to treat 80 people need to be treated for one person to benefit as illustrated in the table. The same statistical findings can be presented in different ways to influence perception. This practice, sometimes referred to as statistical deception, can lead to misunderstandings about both benefits and risks. Weighing the benefits. What does the evidence show? When evaluating the benefits of statins, it's important to look at comprehensive data from multiple studies. Meta-analyses of numerous clinical trials indicate that statins can reduce the risk of major cardiovascular events by approximately 25%. However, this benefit is not uniform across all populations. For individuals with a 20% risk of a cardiovascular event within 10 years, statin therapy might reduce that risk by about 40%, meaning roughly 1 in every 25 people treated will avoid a heart attack or stroke. It's also worth noting that many of the cardiovascular benefits become apparent even before LDL cholesterol levels are significantly lowered. This suggests that statins may have effects beyond simple cholesterol reduction, potentially related to their anti-inflammatory properties. Addressing concerns. Common side effects and risks. While statins offer significant benefits for many, they are not without potential side effects. Research indicates that muscle problems are the most common concern, affecting approximately 5–10% of users. These can range from mild muscle aches to more serious conditions like rhabdomyolysis. Other potential concerns include cognitive effects. Some users report memory issues, though large studies have not consistently shown significant cognitive decline diabetes risk. Some research suggests statins may slightly increase the risk of developing type 2 diabetes cancer risk. Multiple studies have examined this. With most finding no significant association, it's important to note that, as with any medical treatment, the decision to use statins should be individualized, based on a person's specific health profile, risk factors, and preferences. Making informed decisions. The Mayo Clinic visualization tool to help navigate these complex decisions, the Mayo Clinic has developed an innovative visualization tool. This tool allows patients and providers to see the potential benefits and harms of statin therapy in a more tangible way. The tool demonstrates that, for someone at average risk, Taking statins might prevent 2 out of every 100 heart attacks over 10 years. Common side effects include gastrointestinal issues in about 2% of users, muscle aches in approximately 5% of users, reversible liver inflammation in about 2% of users. This approach helps transform abstract statistics into more relatable terms, allowing for more informed decision-making between patients and their healthcare providers. Putting it into perspective when considering statin therapy, it's essential to understand both the potential benefits and risks in context. For individuals with a high risk of cardiovascular disease, the benefits often substantially outweigh the risks. However, for those at average or low risk, the decision becomes more nuanced. The most effective approach involves shared decision-making between patients and providers, where statistics are presented in clear, understandable terms. This allows patients to weigh their personal values and preferences against the potential outcomes. As medical research continues to evolve, our understanding of statins and their appropriate use will also develop. For now, clear communication about both the benefits and risks remains essential for optimal cardiovascular care.